Hello everyone, my name is Rose Felipe and this is the tale of Obvi. The selection of a study design is in the eye of the observer. The goal of every study is to collect accurate and well-defined data between an exposure and health-related incident or occurrence. An observational study can reveal the benefits and risks of various epidemiological issues in our population. With an observational study, you can investigate broader ranges of exposures, including the causes, preventions, and treatments for disease. Now let's meet Obvi, also known as observational study. Like myself and many of you all, Obvi has many unique characteristics and functions. Obvi can study the effects of a wide range of exposures and can be used to study preventions, treatments, and causes of disease. Obvi can also be designed in two ways, descriptively and analytically. The primary difference between a descriptive and analytical study is that an analytical study is designed to test a hypothesis. For example, heart disease can be studied in relation to an exposure variable such as weight, diet, and physical activity. Obvi can provide information to explain causes of the disease, incidence, and determinants of disease progression to help us and predict our healthcare needs. Once an investigator calls on Obvi to help with a study, Obvi calls upon his trusty friends Coho and Casey, also known as cohort study and case control study. Both are studies that we've gone over in this course. From the two, I am most fond of Casey. Casey can investigate the risk of disease in relation to various exposures such as lifestyle, environment, diet, and medication usage. Casey is also able to obtain exposure data from interviews, questionnaires, and pre-existing medical records. Both friends play a very important role in Obvi's life. If you were the investigator, which friend would you lean on most with Obvi? Obvi has helped so many of us for many years. Here are examples of what Obvi has done and how he can help us increase our overall health and pursue healthier lifestyles. Obvi was involved in a study of hand hygiene adherence following the introduction of an education intervention. From this study, Obvi suggested that educational interventions should be implemented as they imply that there is potential for increased and sustained adherence to hand hygiene protocols. Obvi also helped us look at smoking behaviors among cancer survivors. Smoking is a primary risk factor for various cancers, including cancers of the lung, bladder, and head. From the study sample, less than 1/2 of smoking cancer patients quit smoking after their cancer diagnosis, and only 62% of smoking cancer patients received smoking cessation counseling from their physicians. With our help from Obvi, we were able to determine that intervention programs are needed to help cancer survivors quit smoking. Want to read more about both of these studies? Review my resources at the end for more information. Obvi was frequently bothered by his study limitations, primarily his inability to have complete control over external and internal influences and factors. One day he met XB, also known as experimental study, who had a different purpose in study design and was equally as important as Obvi. After meeting XB, Obvi began to realize together they could answer various research questions epidemiologists and investigators had. Both Obvi and XB represent a different way of collecting much needed information. That's all for now. Until next time when we get to know a little more about XB. I want to thank you for viewing my presentation. I welcome your feedback and want to know what you've learned, and if any, what questions can I or the professor address. Please feel free to message me or post in the discussion board. Again, thank you very much.